Hey, there we are. Can you hear me?
Yeah.
Okay, but I can't hear you for some reason. I don't know why. Let me turn my monitor up. Okay. How's everybody doing tonight? Well, we got what? How many people? Two or three people in the room. But say something so I can make sure I can hear you, Spencer.
All right. Live Saturday
Got
night
you. Yeah, I got you. Okay, good. We had some sound
technical
issues
difficulty. Yeah.
yeah, when I sounded like I was talking through a barrel 50 miles away, but anyway. Well, glad to see everybody's alive and kicking, and we're doing good. Weather's real nice. And tonight we're going to talk about medical care here, and I think between Spencer and I, we've probably just about had every procedure done that known to man, with except for brain surgery, and that's still
Yeah.
up for grabs. But you know, the thing that I have found medical. Hey, David, how you doing? Medical care here is really good. How what do you think, Spencer?
I think there's like three levels of medical care here.
I
I
agree.
think there's the top notch, then there's the
Mhm.
middle of the road, and then there's the lower government type hospitals.
Yeah,
But
and
overall though, I mean, the doctors are good, and the nurses take good care of you. So
um, I just and I was telling you the other day, day before yesterday or yesterday, I went and had all my blood work done, and I went to a
hmm,
private lab, and they did all my blood work, and then I took my blood work down to Hangdong Hospital, where I'd go and get everything checked, and they looked at it, and I had my alkaline phosphate was a little bit high on my liver, and usually when I go in there, they just check and look at my blood results and issue me pills. But they did an ultrasound on me and came back and said I've got a little bit of a fatty liver, but I got I feel like I got real good treatment there. I mean, I had to wait a little while, but everybody was nice. The doctor spoke good English, and that I got the ultrasound done. I got my medicine. I saw two different doctors. One was a surgeon, and when I went out to pay my bill, it was 300. Plus, I got all my pills. I got 3 months supply of pills, 378 baht. You can't
yeah,
beat
that's
that.
good. No.
What are the best hospitals in Chiang Mai? Spencer, you could probably say better than I could on that because
Yeah, the way I would rack and stack them is Bangkok Hospital Chiang Mai is number one. It's the newer hospital, it's the cleaner hospital, and it's more modern, but it's also more expensive than any of the other ones. Second one would be Chiang Mai Ram. It's still a good hospital, good doctors. It's just an old hospital. Then number three would be Siripat, which is part of Maharaj Government Hospital, but Siripat is a private part of it. So that'd be my number three.
yeah. I'll tell you one that you left out that I enjoy going to and I've been to quite a few times is McCormick. Uh,
I used to
it,
go there.
yeah, McCormick is kind of in between government hospital and the private hospital. It's kind of an in between. The prices that you pay are about in between the two of them, but you get really decent care. And the doctors there are fantastic. I was really
Yeah.
pleased with them the times that I've been
That's a
there.
super old hospital too.
Yeah, it's been around for ages.
Yeah, I think it
Most
was an American or British woman that started that hospital.
I don't know. I don't
McCormick
know.
was her last name.
Yeah. I don't know. I know they're it's a I believe it's a Catholic hospital. I'm not really sure, but because I've seen nuns walking through there.
It is a religious hospital.
Yeah.
Yeah.
Are the hospitals up to U.S. standards? For the most part, yeah, I would think so. The government hospitals, they're up to Thai government standards, but places like Ram, um, Bangkok Hospital, you probably get better treatment in those hospitals than you get in some of the ones I've been
Yeah,
in
those
the
are private
states.
hospitals.
Yeah.
So yeah.
Hey, how you doing?
But like I said though, like for Bangkok Hospital Chiang Mai, I mean, you either have to have insurance or make a lot of money to go there.
Yeah. Well,
One of the two.
my knee surgery But now compare the prices that you pay here and what you're going to pay for in the U.S.
Oh, well, there's no comparison.
My aeroscopic knee surgery that I had at Bangkok Hospital cost about almost 160,000 baht, which is a little over $5,000. And in the States, I don't know what it would cost. It would have been pretty hefty. Chiang Mai University Hospital is supposed to be good and also cheap. Yeah, it is. A matter of fact, Jacko that was on last week, he uh, he just had hip surgery there, and I think it cost him. It wasn't much. It was like 70,000 baht. He was in the hospital for quite a while. But yeah,
Isn't Chiang Mai University Hospital? Isn't that Maharaj?
yeah,
That's what I thought. Yeah, that's a government hospital.
yeah, yeah. Government hospital
Yeah.
easily. Do I
Well,
have insurance?
there is some things that are lacking here. Like I think I told you about this, Bill. Is that I have what's called Barrett's esophagus,
Yeah.
and I just had a endoscopy done, and I have some low grade dysplasia from it, and none of the hospitals here can take care of that. I would have to go
Hmm.
down to Bangkok, and the only hospital in Thailand that has the equipment to do it with is at Bomrangad in
Oh,
Bangkok, which is probably the most expensive hospital in
yeah.
all of Thailand.
Oh, that's amazing. I would have thought Bangkok Hospital would have been able to take care of
You
that.
you, you would think, but I mean, I've been in situations where I got sick one time. I was over at Claymore Hospital, on
Yeah,
King
yeah. I've
Dong
been in there
King Dong
before
Road.
too. Yeah, yeah,
Yeah, I was there for about 3 or 4 days, and they had to do a what is it, the CT scan where they
yeah,
put the fluid into you.
yeah.
Yeah,
That's
see,
yeah,
they didn't have that equipment, so what they did was they took me in an ambulance over to Chiang Mai Ram, did the CT scan there, and then brought me back to
yeah,
Claremore. So I mean,
yeah,
they work together.
yeah. Well, I think if I'm not mistaken, Chiang Mai Claymore and Ram are the same company. If I'm not,
Oh, are
that's
they?
what I've heard. Yeah. Now, when I had a place on my neck that was giving me a problem, and I went to Dr. Morgan, and she sent me over there to Claymore right across the street, and I was in and out in about an hour, and had surgery done on my neck, and it's only 2,000 baht. I was real happy with it. Now,
Hmm, hmm.
I wasn't it it's not the cleanest hospital.
No.
I mean, I was wheeled into a room with there were probably 10 other people in the room, and what the
Mhm.
doctor was just doing was going from patient to patient to patient.
Hmm.
And but they took care of my problem. Do you have insurance? Yes, I do. I have health insurance here, and the kind of health insurance that I have here is for inpatient only. Outpatient, I pay all myself, but inpatient, I've got about 200,000 worth of coverage, and that would pretty much cover just about anything that I would need to be done. And I've got a high deductible, but the deductible really isn't that bad. But yeah, I do have insurance, and I know Spencer, you've got tons of insurance.
Yeah.
It's pretty much a necessity. If you live here, you should have it. I had a friend that had her baby at McCormick. I've talked to a lot of people that are really happy there.
Hmm.
I'd put third option. Well, I'm going to tell you what happened to me when I went to that particular hospital that you mentioned. I had a urinary tract infection, and I called the hospital. And I told the hospital, or no, I didn't call them. I emailed them, and I said I want to come in and I want to see a urologist. And they said no problem. They emailed me back. They set me up an appointment, told me what time to be there, what lady to go see, and all that stuff. So I showed up on time, went to the place that she told me to, told her who I was, told her why I was there, and they sent me to a doctor. He looked at me and ran all kinds of tests on me. I mean, just all kinds of stuff: blood tests, urine tests, ultrasound, just a bunch of stuff. Told me to come back the next day. So I come back the next day, and they put me with the doctor, and the doctor says, "Well, all your tests came back fine. I don't, we don't know what's wrong with you." And he said, "I'm going to have to send you to a urologist." And the nurse who had been there the night when I came in, she was standing right there. And I said, "Well, I saw a urologist last night." And she goes, "They put me with a regular doctor." I was so aggravated after I'd spent all that money. I sent him a nasty email about it, but
Hmm.
she apologized and just said that somebody somebody messed up. But here I think I ended up spending about 2 or 3 thousand baht there, and I ended up going to McCormick and getting it straightened out. It's just an infection, is all it was.
I had a
And
bad experience there too.
I,
They
I
I went there and they said I had a heart attack, and it wasn't a heart attack.
oh, my dad had ferrets. Good morning. Hey, how you doing? It's morning there? Yeah, it's nighttime here. I was at Claymore my final night in Chiang Mai. Yeah, it's a
Mm.
good. They got you in. They get you in and out fast. I don't have any, any complaints there. From the outside, it doesn't look like much, but I guess when you get in there, it's the kind of care you get. How are the rooms in there?
Well, they built a new section to it behind the old hospital. So when you look at it from the road, all you see is the old grotty part of it.
Yeah,
But behind it is kind of a newer building. Well, it is a new building. I mean, when I was in there, I was in the old part, and the rooms were a little bit spooky.
yeah.
So,
Sounds like you went to McKean Hospital. I got a story about that one.
yeah, I don't know, but all the rooms, all the hallways were dark, no lights on, and it was kind of
I, I've
spooky.
I've I've told this story before. McKean Hospital is the old leper colony from back in the early 1900s, and after they cured leprosy, it's basically a kind of a retirement home, but they have a
Mhm.
hospital there, and it's basically a hospice care situation. And when my friend had cancer, he was sitting in Bangkok Hospital, and it was just eating his bank account. So we moved him over to McKean Hospital, and Lex still gets the chills when we go by there. But the the night we brought him in there, she had to go to the bathroom. She ended up down a hallway and stuff, and the place is just, I mean, it's clean and everything, and the staff is great. It just has that eerie feeling when you're walking through there.
Mm,
And
mm.
I tried to find, I couldn't find her, and I was going crazy. She was like, I don't know where I went, but I'm not coming back here again. But they're doing a lot of work on the river by there too. Ambulance ride both ways, stay, doctor visit, and meds were $88 out the door. Yeah, it's. I was pleased with the care that I got. I like I said, I didn't get up in a room. They had me in a kind of a triage center with a bunch of other people in there, but I got treated and I was fine. Next time I'm in Chiang Mai, I want to get a full medical checkup. They have different packages that you can get uh, at the different hospitals, and you just have to go through and look and see what you want and pick out what you want. Another thing too, we've got Dr. Morgan here, and she does it, and she does an excellent job at it too. Dr. Morgan to me is probably there's two really good English speaking doctors, and one of them is Dr. Morgan, and the other one is her last name begins with an A. She's over off of Canal Road, and I've been to both of them. They're both very good. If I've got something that I need to see somebody quick, and it's not something that I trust with a clinic, I go to one of those two.
Now
But
I use Dr. Sharon. You can't forget him now.
who?
He's Dr. Sharon.
I don't know him.
You don't know him, huh? Yeah, him and his wife both practice medicine. He actually worked at New York Metropolitan Hospital for many years.
Oh, and
And
where's
that's
his
where he met.
office at?
It's over there off of Canal Road. No, not Canal Road. It's on around the moat there. What's the name of the road? Dr. Sharon is. It's kind of across from the Happy Frog,
Okay.
or where where Mad Dog's Pizza is.
Yeah, yeah, yeah.
Okay, it'd be across the moat from there.
Okay, yeah, I know what you're talking about now. I didn't even know there was a doctor in there.
Yeah, he was a professor at Chiang Mai University. He speaks 7 languages fluently,
Oh,
English being one of them.
hmm, that's
Hello.
interesting.
Yeah.
Hmm,
Yeah, but he's the one I go to. I went to Bangkok Hospital when I with my hypertension, but I just didn't like those doctors there. The
yeah.
the heart clinic there, those the doctors just excuse my French pissed me off. So
Hmm.
I just started going to Dr. Sharn, and he's been my heart doctor, for this
Hmm.
whole time. But I mean, I've been seeing him for 9 years. So
Is he a good heart doctor?
yeah, yeah, he
Huh.
he knows he's like a House, Dr. House on TV. He can cure pretty much anything.
Huh. That's interesting. I've never seen. Now I've seen a sign out there
Yeah.
It's kind of in like almost in like a warehouse on before you make the
Yeah.
corner to go left. Yeah,
Yeah.
I'll
Yeah.
have to check him out next time.
Yeah. He's probably like in his 70s, so he's not like
Yeah.
he's young. So,
Well, it doesn't matter to me as long as his hands are steady. Do you think
mm,
foreigners get equal care as locals? Yeah, when I go to the government hospital here, I get just as good as care as the locals do. Um, I wait in line with them, and nobody jumps in front of me. And the doctor, this last doctor that I had was a female, and she took my lab results, which is something that they don't usually do, and she went down every aspect of every test that they did on it and explained it to me what it was, told me what I needed to do and what I needed to improve on, and what foods I need to stop eating, like pizza and spaghetti. And I just kind of laughed at her, but yeah, I get real good care, and the nurses, they all know me there. They see me, they wave at me, or they if they don't speak English real well, they'll motion me over and get me where I need to be. I'm really pleased with them, and they're really really nice people. Time before last, I was so pleased with the service I got. I went over and bought them 3 dozen donuts and brought them back.
mm.
Now they really treat me good. What's good to do that? I don't know what you're asking, but whatever. Yeah, okay. Yeah, Dr. Sharon. That's the sign that I see out in front of there, Dr. Sharon.
Mm, mm.
Sharon.
Yeah,
Yeah.
and his
I
wife's
thought
name
he.
is Sabati, and she's a pediatrician,
Okay.
so she
Is
takes care of
she
the babies.
is she Indian?
Yeah, she's from New York though,
Okay, okay.
and he's
That's
Indian. He's Indian too, but he
okay.
he was born and raised in my wife's hometown,
I'll be darned.
and the family owns a clothing, what do you call it, like a shop there where they sell like linens and cloths and stuff. But all his
Hmm.
children, all his relatives are doctors, are either at Chiang Mai Ram, Bangkok Hospital. I mean, he's got
Yeah.
kids and relatives are all doctors.
Huh. Well, that's the kind of person to find. If you get a problem, a good doctor that speaks good
Yeah,
English.
yeah,
Uh, yeah, I have gone by that sign a hundred times, but I
yeah.
never stopped there.
See, that's one of the things about here is that a lot of these doctors, they'll work in the hospital during the daytime, and then
Hmm.
they have their own practice at nighttime. So let's say like it's, I don't know, 5 o'clock, 6 o'clock. They'll actually leave the hospital and go open up their office, so you
Yeah,
can go there and get to see them for a lot less.
yeah, yeah. I think most of them charged between 200 and 300 baht, at the most.
Mhm.
That's what I try to do. I try to find a specialist or something at their clinic and go there rather than
Mhm.
go to
Mhm.
if you go to the hospital, you're gonna pay, a little
Mhm.
bit more. What hospital would be good for full medicals? I'd probably say Bangkok Hospital would probably be Bangkok or Ram would be the best.
I
And
had one done at McCormick. It wasn't bad. They went through
mm,
all the stages, so I would put McCormick up there too.
the private hospitals tend to keep you coming back as it is a business, using the doctor's cheaper and the same service. Well, what I found in the public or the private hospitals is, and this happened to us at Ram one time. I took Lek up there because she had hurt her knee, and they X-rayed her, and the doctor looked at it and says, "There's nothing wrong with your knee or whatever." But when we went out, they sent us to the pharmacy, and I came back with a bag, almost a grocery bag full of pills, and that's what they try to do. They'll try to put a lot of stuff on you that you don't need. Now, when I went to Bangkok Hospital for my surgery, I emailed my doctor before I went, and I said, I don't want, whatever you're prescribing for me, write a prescription and I'll get it, outside. And I ended up getting it from Bangkok Hospital because it was only like 8, 10 pills that he was going to give me. But that's how they make their money. And also too, they'll run some tests on you. They'll run a lot of tests on you in the private hospitals. When I had to do my pre-screening for my surgery, that was 13,000 baht,
Mm.
and they did the complete rundown on my heart, which was it was good. They did an ultrasound and all that, and they did all my blood work, and but I think the ultrasound of the heart, I don't think he really needed to do, but it did. I got the bill for that. That was like 7,000 baht, and then I had to pay that myself. There's a lot of clinics and hospitals, doctors. Yeah, yeah, that's very true. And the thing to do is find out which doctor you want to see at what hospital, and then find out if he's got a clinic, and then go to the clinic and see them there. Um, I did that with when I had that spot on my nose. Um, Instead of going to Ram Skincare Clinic, I found out the doctor that worked there. And sure enough, she had a clinic over on Canal Road. I went over and saw her. She scraped it, set it off, and it came back, and I had to have it taken off. And then she sent me to another doctor who was a plastic surgeon. It ended up costing me like, I think it was about 12,000 baht by the time I was done. But had I gone to Ram, I probably would have got stuck with a Ram surgeon and paid their prices. I went there one time. I thought it was funny. I thought I had a mole on my neck. It just kind of appeared, and I couldn't, I couldn't see it. I couldn't feel it. Lek looked at it. You got mold on your neck or something. So, shit. I'm gonna get this checked out. So I went to Ram Skincare Clinic, and she looks at it. She goes, "You got a tick in your neck." Shit. And she goes, "You can take it out two ways. You can either have it cut out, or I can take it out with a string." So I had her cut it out, and that was like 2,400 baht. But I saw her again at her own clinic, and she only charged me 600 baht. So, who knows? Says, "I'm in Chiang Mai and embarrassed to say that 2 years late for teeth cleaning. Can you recommend a good dentist?" Um, not really. I really don't know of any. I've heard Smile Dental Clinic is real good. I've just seen that on Facebook. Um, Now there's
All
another.
the hospitals have dental clinics too.
Yeah, that's true. Yeah. Now I've heard McCormick
The
has a good
one
dental
on
clinic.
the third floor.
Yeah, we
Um,
go to the one at the Airport Plaza Mall up on the third floor. When you come out of Robinson's, there's the dental clinic right there. That's the one we use. But I
hmm,
mean, I've heard good things about. Good things about McCormick Dental Clinic. I've
yeah,
heard good things about Bangkok Hospital Dental Clinic and Chiang Mai Ram. So
yeah.
it's
Well,
up to you. I mean, there's
yeah,
lots of places.
yeah, even the government hospitals will have 2 days of dental care,
Yeah,
and you can go that you can walk in there and get your teeth cleaned or whatever. The last
yeah.
time I had my teeth cleaned, I used a doctor on Pangdong Road, and I think it cost me like 300 baht or something like that.
I mean,
But
dental clinics are just like hospitals. I mean, there's like some that are like beautiful and way up here for price,
yeah,
and there's some that are just real low priced where they use a string to pull your tooth out with.
yeah. I'll tell you a little story on me. Happened back, would have been 2000, probably 2005. I had some dental work done in the United States, and they had reconstructed one of my teeth in the back, and it was probably about 3 months before I was supposed to come to Bangkok. And we get to Bangkok, and we were staying at the Swiss Lodge on Soi 11.
Mm.
And man, this tooth just started killing me. Hey, Pete. Oh, there's PB. Um, Tooth started killing me. Good morning. And we went downstairs, and there was a dental office just right around the corner from where we were staying. They go in, and this dentist came out, and she was a girl. She was probably about 25, 26 years old. Beautiful, just long black hair, and she's grinding on my tooth, and doing all this stuff. And uh, what she said was that it was not sitting right with my other teeth, and it was aggravating it.
Mm.
And she filed it down, and said, you'll be fine. And I get back to the room, and we go the whole day. And that night, I mean, it was so bad. I was drinking cold water. It hurt so bad. And
Mm.
I told Lek the next day. I said, I'm going back. So the next day, I go back in, and it's a guy, and he X-rays the tooth. He says, root canal. And I said, no, I'm not having no root canal. I'm on vacation. I've had one or two root canals done, and I'm not having another one done. I said, pull. It's root canal, pull, root canal. We went back and forth. I said, finally, I said, either pull it or I'm leaving. And he snatched it out, and I was fine for the rest of the trip. but he wanted to give me a 10,000 baht root canal for a tooth that,
Mm.
I wasn't worth saving. It was really, really bad. It was
Mm.
kind of funny, but he got me good. I'll tell you another story. This is kind of funny. Back in the States, I was working drugs, and one day I had this tooth that was really, really bothering me. And, I kept putting it off, kept putting it off. And one night, I mean, I was at the office and we're going to do a search warrant that night. And I said, I got to do something. This tooth is just literally killing me. So thank you, Jeff. I really appreciate that. Thank you. Um, I got to do something. I can't function with this tooth in my head the way it is. And we had this doctor that would come in and do the prisoners. His name was Doctor. God, what was his name? I can't think of his last name. Anyway, he was an old guy, and the prisoners hated him. They just didn't like him. But Doctor Stansbury, and he also had a son that was a dentist. So I called Doctor Stansbury up and I said, Doctor, I'm dying. He said, Can you help me? Oh yeah, come on over, Bill. Just come right over. His office was about 3 blocks away, so I ran over there. And he looks at the tooth and he's you know poking at it and X-rays it, and he said, it's all infected. He said, I can't numb it, so I can't pull it. And I said, you pull this son of a bitch. I said, I want it out. And he says, you don't want it pulled. And I said, I want it out. I mean, because I was dying. He says, I can't numb your mouth. You're just going to have to, you'll have to. I said, jerk this thing out. I said, I almost pulled it out myself with a pair of pliers. I said, you can do it. So it's so funny. I'm sitting in the chair and I'm not expecting what's coming, and he grabs these big pairs of pliers and he grabs hold of the tooth and he props his foot up on the
Oh.
on the side of the chair and wham! Well, that tooth came out and I mean blood just spurted everywhere. And
Oh.
I'm sitting there, "Oh!" I was in agony, dying,
I
pain,
bet. I bet.
just crying. I never felt pain like that before. But
Mm.
hey, that's the way it is. But he jerked that thing out, and I had blood all over my shirt and all over the place. And he said, "I told you it was going to hurt." I said, "Yeah, okay. I know. I'm going like this." And I go out and I think I paid $5, and I said, "You're at least going to write me a prescription for some hydrocodone,
Painkiller.
aren't you?"
Yeah.
Oh yeah, yeah. So he writes me out a prescription. I got it filled, and I ate about 2 hydrocodones before we even left the office. That was Don't ever have it if they can't numb it. Don't do that. How
Yeah.
those cowboys made it in the old days, I don't know. I mean, a shot of whiskey wouldn't have done a damn bit of good. I mean,
Mm-mm.
that thing came out and I heard it snap and I heard the
Oh.
bone crunching and oh God, most
Dang.
ungodliest pain that I've ever felt in my life. I mean, I broke bones before, didn't hurt like that. And
Mm-mm.
but after a couple of hydrocodones and the next day I was feeling fine. No big
Yeah.
deal. But I'd never recommend anybody if you've got an infected tooth, take the antibiotics and get it cleared up before you have it pulled.
Mm.
Because that's what he's going to do. He's going to give me antibiotics and send me home. And I said, I've got to have this damn tooth out. And he said, now my son wouldn't do this, but I'll do it. Wham! Well, I'll tell you what, it was unbelievable. It was just it was crazy, but it just shit you go through in your life. And you learn from it. But fortunately, since I've been here now, I had a set of teeth made in Vietnam.
Mm.
When we were in Saigon, I have an upper partial, and it's it was probably 10 or 12 years. Yeah, if in doubt, pull it out. That's exactly what I did. But we walked by a. Thank you, PB. I appreciate that. That's very much appreciated. Thank you. Um, we walked by a place and they were advertising, um, you know, uh, making partials, and the prices were reasonable. I mean, I didn't, I figured probably I think it ended up costing me like $200, and wheeled me in there and fit my my teeth out, and told me to come back the next day, and I picked it up, and that's what I'm wearing today, and it's 10 years old. It hasn't given me a bit of problem.
Hmm.
But they weren't dentists, they were just, it was just, I think like they have here, and they fitted it up, and man, that thing
Hmm.
fit snug, and I've never had a bit of problem with it. So,
Hmm.
it's, there's good care here. You just have to hunt around for it. And
Yeah.
I feel confident with the doctors here.
Yeah.
Um, and I know you do, you put a lot of faith in the doctors here,
I do.
you know, but the thing that, and this is how I do it. I've got the hospital, which is 2 blocks from me. I use them for I have to take warfarin, and I have to get that checked now I get it checked every 3 months. But I do that there. I had endoscopy done there, and I had a colonoscopy or whatever you call them. I had one of those done there. 5,000 baht for each of them, and that was with an overnight stay and knocking out. Uh, and I use them for that. Now, if I'm get like the sniffles or my hair's standing up on my head, playing with my hair. If I get the sniffles or something like that, there's a clinic right across the street, and I'll go across there. She is I forgot, forensic pathologist, and she runs an office over there. She's the forensic pathologist up at Chang in the government hospital, and she'll check me out. She'll give me pills and check my heart, and she's actually the one who got me to stop smoking cigarettes. Uh, and if it's something simple, I'll go there.
Hmm.
Um, if it's something major and I don't really want to go to the government hospital, I'll go like to Dr. Morgan or one of the other doctors, and then they'll send me somewhere else. Or, you know, like with the knee surgery, I went to a specialist and he looked at it, and then he took me to Bangkok Hospital. So it just depends on what's wrong. If you break a leg or something like that, you want to go to the nearest hospital and get fixed up, and they'll treat you. They'll treat you. They have no problem uh,
How much did you
treating
pay
you.
for your endoscopy and colonoscopy?
I paid 5,000 baht for my endoscopy, and that was with an overnight stay, and I'll talk about that too. And then the colonoscopy paid 5,000 baht for that too,
And
and
see,
that was
that's the difference right there. You paid 10,000. I just had the same thing done at Bangkok Hospital, and it cost me 30,000.
yeah, yeah,
So there's you can see the price difference.
yeah. And
Yeah.
when I had the colonoscopy done, I checked in, and the nurse downstairs, and like I said, they all know me, and she says, you want the good room, don't you? And I said, yeah, put me up in a good room, and they wheeled me up to this room up on the fourth floor, and it was really nice. Nice bed, nice sofa there, TV set, and air conditioning, and the lights were on and everything. It was really a nice setup, and it was 1,200 baht a night, which was not bad. And the next time, and this is funny, when I go for the endoscopy, I do the same thing. And Lek wasn't with me. I just went and checked in, and she looks at me and she goes, you know, where do you want to go? I said, I want to go to one of the good rooms upstairs. So she gets on the phone and she calls up there, and they're all booked up. They don't have a room. She hangs the phone. She goes, I got to put you in the ward. So well, that can't be too bad. Um, so the guy comes down with a wheelchair, and he gets me and wheels me up. And I think it was on the third floor or something like that. And they've got me out in the damn hallway. They've got beds lined out in the hallway, and the hallway is open. It's
Breezeway, yeah.
yeah, it's a breezeway, and there's no fans, no nothing. It just, oh shit. So I got on the phone. I called Lick. I said, you get your ass up here. You bring me some ice, bring me some cold drinks or something. I said, I'm dying. And he goes, what's the matter? I said, they don't put me in the good room. I'm out in the hallway. So she comes up. She's got a big bag of ice that she's bought at 7-Eleven. She's got a bunch of stuff for me. I'm sitting out there, and she gets there, and she takes one look at me, and she's laughing so hard she's crying because I'm sitting there, and the sweat is just pouring off me. and there's another Thai guy in the bed 2 or 3 feet over, and he's just kind of looking and laughing. But they about 8 o'clock. By 8 o'clock, I was fit to be tied, and I thought they were going to put an IV in me because they did that when they did the colonoscopy.
Mhm.
And Lek went to ask him because they hadn't done it yet. She said, "Well, we're not going to give him that until in the morning." And so Lek looks at her and says, "Well, how about this? We only live 2 blocks away. How about he comes back 6 o'clock in the morning and you put the IV in him and he goes to surgery?" So the nurse went over and talked to the doctor, and the doctor said, "Yeah, send him home." I got them damn clothes ripped that thing off, flying home. I slept in my bed, and the next morning we woke up 5:30, went back to the hospital. I laid on the bed like this. They came and stuck the needle in me, and it was funny. I mean, I and really, in all honesty, I would have rather, if I had to go in the ward, I would have rather been out in the hallway than inside the ward that they had with all the beds together, because it was.
Mm.
I mean, they had beds crammed, packed in there, and I had to walk in to use the bathroom, and the smell was just terrible. I'd never do that again. Um, but that was my experience, and Lex still laughs at me about it. Uh, it's just part of it. Hello. Let's see what the next question is. How can I find out what meds I can't or can't get? My husband's at regular prices are quoting really cheap too. Have you found any medication that you weren't able to get here, Spencer?
Uh, some of it is restricted. That's one of the good things about being here. Excuse me, is the fact that you can go to a pharmacy here and get a lot of medications straight from the pharmacist that you couldn't get in the States. Like I have asthma, and I use an inhaler, emergency inhaler. I
Mm-hmm.
can walk into any pharmacy and get one of those without a prescription. In the States, I'd have to go through hoops to get one of those things.
Yeah.
But any kind of medication that's like for your head, mental health kind of pills. I think most of those require a prescription from a doctor, but I haven't come across any medicines that I can't get here.
Yeah.
They may be more expensive because they're imported in, but I can get them here.
Yeah. I'll tell you all, if you come to the pharmacy that I deal with for the stuff that I have to buy, I go to Pure Pharmacy right down from Taipei Gate. There's a
Mm.
Chinese lady there, and she is really, really good. And basically, what I do is I'll find it on the internet and I'll send it to her on Facebook, and she'll tell me if she's got it, um, and how much it is. And if she doesn't have it, she'll tell me where I can get it. Some of the
Yeah,
stuff you have to get at the hospital. Like
yeah,
you can get some pain pills, um, but most of the stuff, you have to have a prescription for. Now, I have heard people being able to buy Valium. I've never tried it, but
yeah,
I've heard of that before. But some of
yeah.
the stuff you can get it, but you have to go to a hospital to do it. I was trying to think
The
of what it
best the
was.
best thing to do is like if you're coming from the States, there's a lot of times there's a difference in brand names. Like something will be called something in the States and it'll be called something different here.
Yeah,
So the best thing to do is just write down the chemical name of the medications that you need, and then go to a pharmacist and they can look it's a big book, and they can pull it up and see what it is called in Thai,
yeah,
and give it to you. There's one that I was taking in the States. I can't remember what it is now, but over here it's called something totally different, but it's the exact same medication, you know? So yeah, it's just write down the chemical name of the medications you need when you come over here.
yeah. They'll have something that's comparable to it. Now,
Yeah.
and also you'll find too, like my Warfarin that I take, I was paying. Well, my insurance company was paying for it, but here I pay $4 for 100 tablets.
Hmm.
You know,
Is it
I'm sorry.
generic?
I'm sorry. Yeah, yeah, generic
Yeah.
morphine. I'm sorry. It's 400 baht, so sixteen
Hmm.
dollars for
Hmm.
100 tablets. But it's a lot cheaper than it was in the U.S. And I also found
Yeah.
it to be more. When I went from getting my warfarin in the United States to coming here, they rechecked my blood, and I actually needed less of it than I did in the States because of the potency was better.
Mm.
So there
One
is a
thing I
difference.
noticed about here, is like in the States, you go to a doctor and it's like you can't just walk in and see a doctor. You have to call and make an appointment. Could be a week, could be 2 weeks before you see a doctor. And if you need surgery, heck, it might be a month, 2 months, 3 months before you even get to go in and get surgery done. But
Mhm.
here, I can walk into any hospital and get seen and treated right then and there on the spot, and
Yeah,
surgeries are almost immediate.
yeah,
You
yeah.
know,
I didn't, when I had the two procedures done, I didn't have to. They scheduled me an appointment, and I think it was within a week, and I had no problems at all. When I had my knee surgery done, I was the holdup on the knee surgery, not the hospital or the
mm,
doctor. Actually, I wasn't. My insurance company was.
yeah, I
My
remember that.
friend, my friend got dentures in India. He met us. He looked this red. We left. He's
Mhm,
already took the new ones out, put the old ones back in, and threw his new teeth. That's funny.
mhm.
I wouldn't need to go to the doctor first.
It just depends on what it is you need.
Yeah,
I mean, if you need like insulin or something like that, obviously you're gonna have to go see a doctor for that.
yeah,
But if it's something like a normal medication that's pretty common, you might be able to just get it from a pharmacy.
yeah,
Wouldn't even need a doctor prescription for it.
yeah. Antibiotics and stuff like that you
No,
can
yeah.
buy. Um, some pain medications you can get like uh,
Like I said, my
Commodore.
asthma inhalers, I can get those
Yeah,
right off the
Commodore.
shelf.
Yeah. Um,
Singular, I can get that right off the shelf, and it's just depends.
let's see. Before I moved here from the U.S., I checked with my U.S. doctor. She had absolutely no problem with eye doctors in the system. She was Doctors Without Borders and fully, yeah. I'm very pleased with the doctors here. I can't. I don't have any complaints. Now, one of the things that I have noticed that you'll see the difference between the doctors in the U.S. and the doctors here. They are when you get a little bit older, they're a little bit more prone to say, well, that's old age,
Mhm.
and you really you have to push them that way. It's like with my knee. The doctor said, well, you're getting old. I said, well, I know it can be fixed because it was actually an injury. But
Mhm.
that's the thing that I find, and I went day before yesterday and had my eyes checked, um, because I was afraid that's what was causing my headaches. And the doctor checked my eyes and you know rewrote my prescription. I've got some good glasses coming, but she looked at my cataracts, and whereas a doctor in the United States would say, take have your cataracts taken out, she said, you know, they're not bothering you. They're not affecting you. At your age, you're going to have cataracts. And she didn't even check me. She just looked in my eyes. She says, "Yeah, you probably got them in both eyes."
Well,
Whereas,
that's just
in the
like the other
state,
day. You were talking about fatty liver. I mean, that
yeah,
just that just happens as you get older. You get fatty
yeah,
liver.
yeah. Well, I know that, and they at Hangdong Hospital over there, they were, uh, they told me how to take care of it. They said
Mm.
you got too much weight on you. You're not eating the right foods, and I mean, she nailed it. I mean, I can't argue with her. I'm eating pizza and spaghetti and
Yeah.
crap like that, and
Mhm.
burgers, and not riding my bicycle, which has changed. We changed that today. Surgery on the spot. Yeah, you can get if you want to have something done and you need it done. If you walk into the hospital, they'll take care of you real quick.
Real quick.
Any painkillers with codeine?
Yeah.
Yeah, yeah, I think you're right, and that's one of the things that I've noticed here as far as pain medication. They don't dish out a
The
lot with
reason
codeine.
is
Hmm?
people been mixing codeine with cough syrup to get
Mm.
high.
Yeah, yeah,
Mm.
yeah. That's a big problem.
They
They
do that
did
in the
that in the
states too.
States. Yeah.
Yeah, they put it all behind the counter at Walmart and stuff. Cough
Yeah, yeah.
medicine.
Well, what
Yeah.
they were doing is that they're filtering out the codeine
Mm.
and then shooting the codeine out and stuff. It's just
Mhm.
crazy. But yeah, you can get stuff now. And the cough syrup here, I haven't seen any cough syrup with codeine in it on the
No,
shelf.
and most of the stuff I see is like you can get imported stuff, but a lot of herbal cough syrups,
Yeah, yeah,
and those work though. I mean,
yeah.
I
I
have no
mean, yeah,
problem
I
with
don't
them.
have any problem. Um, it's just the way it goes. But I have you ever seen hydrocodone get dispensed up here over here?
No.
I
Mm-mm.
never have either. I've never even heard of it being dispensed over here.
What's
So
it
I don't.
for?
Hydrocodone is a painkiller.
Oh,
It's a
painkiller.
highly like OxyContin and all that crap.
Uh,
That they've got a big problem. I haven't seen it here.
I mean, I get painkillers, but it's I just let my doctor prescribe them to me. It's like because I have hypertension, I can't take a lot of painkillers. So he gives me these first generation painkillers that don't affect my blood pressure.
Yeah, that's the best
So
kind to get. You know.
yeah, yeah.
Well, when he did my knee surgery, he gave me 10 tablets, and I read what it was, and it was Tamadol or something like that.
Tamadol, I think. Yeah.
Yeah, yeah. And I never used them. If I got a bad headache or something, or I want to go to sleep at night, I'll take one. But I was amazed that I've not seen any doctor or heard of any doctor prescribing hydrocodone here. So I don't
Yeah,
know
I
if they
don't
just
know.
don't have it. But now they do. I know they do have Valium because I've read on Facebook where people have been able to go in different pharmacies and buy Valium. They're not supposed to be able to, but there are some
Well,
that
that's
sell
just
it.
like anabolic steroids. You're not supposed to
Yeah,
be able to buy them, but you can walk into some pharmacies and get them.
yeah, yeah.
So
It was funny the other day. We talk about things that are illegal and um, vaping.
Yeah,
The
vaping.
vaping they completely illegalized it and shut it all down. And somebody on Facebook asked where they could get one, and by God, there is a Facebook page that sells all that stuff. I mean, right out in the open. I mean, they sell uh, the vaping machines, the liquids, and all that stuff. And I don't know how they're doing it, but they're getting away with it.
That's something else you have to address too is the fact that marijuana is legal here now.
Yeah,
So a lot of people use marijuana for pain relief. So it's legal here. You can get it in all these little shops that sell it.
you can almost buy it. I think you can buy it at 7-Eleven now.
Can you really? I know they
Well,
got drinks and waters with that stuff in
yeah,
it.
yeah.
And
Because I saw a sign when I went in 7-Eleven. It said cannot sell any marijuana products to anybody under the age of
mm,
20, I think is what it said. Speaking for myself here, I know you guys, GYN doctors for women. Yeah, there is, Lek has used
And the
3 of them
hospital.
here. There's one on Canal Road that we've used once, but all of the hospitals have very, very good GYN doctors. McCormick has an excellent program. Um, Lek's been to that one twice. She's been to the one at Atlanta Hospital. That was expensive, but they ran all the tests on her, and she was there all day, and they checked everything on her. And now she goes to Hangdong Hospital. They have a thing once a year where they come in and they get checked down there, and that's for her it's I think she has to pay 30 baht. But yeah, there are plenty. As a matter of fact, there's a GYN in Hangdong just north of the market, and she works out of the hospital
mm.
and the Hangdong Hospital.
Yeah, it's
So
not a problem here. You can find them
yeah,
everywhere.
yeah, yeah, and they're good doctors. Tramadol is heavy stuff, very addictive, but works for heavy pain. You can get it over the counter here easily. Yeah, yeah, you can. Um, I have not bought any of it, but I know the lady here at pharmacy has it. But I'm amazed if it's I don't know that it's addictive or not. I'm taking your word for it, but I'm amazed that if it's addictive that they'd even be selling it. But who knows? Valium is definitely addictive, and there are places that you can buy that too.
Yeah, you can get pretty much anything here.
Yeah, you just got to ask it, and if you go to one pharmacy and they don't have it, go to the next one, and they're very likely to have it.
Yeah.
And their prices are very reasonable. Some
and
of
here
the
also, oh, go ahead.
no, go ahead, go ahead, you go ahead.
Well, I was just going to say that every time you go to a doctor here, either at his clinic or at the hospital, the price that you're paying includes the medication.
Yeah,
You
yeah,
don't. It's not like in the States where you go see a doctor, he writes a prescription, then you got to go to Piggly Wiggly, turn it in, and then pay some money there and get your prescription. Here, you get it when you get seen by the doctor.
yeah,
So that's really helpful.
yeah. Well, it's like that clinic that I go to. If I've got the sniffles or something like that. Matter of fact, when we were in Phuket, I had a blister on my foot, and it just wasn't healing up right, and it started getting red. So I went over to her, and she looked at it. She gave me a bunch of pills. I mean, 10-day supply of antibiotics, and looked at the
Mm,
foot, and you know, walked out, paid 250 baht, medication and all.
yeah,
And so that's the good part about it. You're not running from the doctor to the pharmacy.
right,
Uh,
right.
and now some of the doctors I've seen, very few of them, but they will charge you extra for the pain or for the medicines. I've seen a couple that do that, but very few of them. Most of the clinics
Mm,
that you walk into, uh, they'll give you whatever you need. Now, if you need something, they may not have like my warfarin. They're not going to have stuff like that. That's stuff that you have to buy either at the hospital or at the pharmacy, or any kind of special medication. You may have to go. They'll write you a prescription. You may have to go to the hospital to get it. But
mm.
most of the time, if it's something to treat like an infection or a cold or a sore throat, uh, they'll go ahead and give it to you.
Yeah.
Let's see. Sounds like Chiang Mai is a lot cheaper than Bangkok.
Oh yeah.
Yeah, I've found that very true. Even food, food's a lot cheaper here than it is in Bangkok. There's a Piggly Wiggly. I haven't seen one. Have you seen one? Piggly
No,
Wiggly?
I was referring to the States when I was talking about that.
We've got just about every place but that. I have not seen a Piggly Wiggly, and I haven't seen a Publix yet.
No.
They'll get here one day though. Tramadol is addictive indeed. I was prescribed once, and my doctor warned me about it. Michael Jackson died from tramadol. He's using it heavily. Yeah, that's bad. I have seen people get addicted to painkillers. I had a very good friend of mine that I worked with that had a wisdom tooth pulled, and they gave him OxyContin, and he got addicted to it. And he denies it, but he was. You need to watch what you take. Fesseco Pharmacy has a discount
Mhm.
card. It can give you 60% off. They order as needed and follow up with notifications. Yeah, now I don't know what pharmacy I use, but I use one just north of the market that gave me a little discount card. And I was
Farmer
buying
Choice
my
does it too.
yeah, I was buying my stuff for my joints. I forgot what it's called now. And they said, well, if you have a card, you get so much off. So they gave me a card right then, and I bought it.
Hmm.
So a
Hmm.
lot of the places will give you a discount.
Hmm.
Now I don't think Pura has one. Uh,
No. Yeah, if you use the ones at Big C, you just show your Big C card.
huh? And you
But
get a decent discount.
I don't know. But I know that
Hmm.
Pharma Choice and Facino both have the
Huh.
discount cards. So, and I use the
Did it?
Pharma Choice on Canal Road myself.
Okay. Now,
That's a
do
big
they
one.
give you a discount card?
Yeah, yeah,
Huh.
yeah,
I'll be darned.
yeah.
Huh. I usually I usually go in the market. There's a girl that has a pharmacy in there. I think she's the pharmacist at Hangdong Hospital as well. And I usually go in there and I can get antibiotics for 100 baht or
Hmm.
uh, whatever I need. I'll do that. And if she doesn't like, they don't have Warfarin there, so I go up into the city to Pira Pharmacy and I'll buy it there. But I only do that when I go past my appointment date for Hangdong Hospital. If I miss it, then I have to go up there and get my medicine. Yeah,
Hmm.
at one time I sent Lek over to Hangdong Hospital and they gave it to her, but sometimes I'll buy it up there. And but it is what it is.
Mhm.
They're very, very. Most of the pharmacists here, if you go in and you tell them your symptoms, they're trained more to say what you need. Like if you go to the pharmacy and tell them you got a stomach ache or something like that, they'll know what to give you, and they'll give you whatever you need to take care of your stomach pain. So
Mhm.
you don't always need to go to a doctor. Now, what kind of training they have, I really don't know. I don't know. I don't know if they're licensed or whether they just you know
I think they
have
go
a
through
shot.
medical. They go through medical school too.
Yeah, I know the lady at Parapharmacy is excellent. I mean,
Mhm.
she knows the drugs, and she knows that, if you go up and tell her your head hurts or something like that, she knows what to give you. Or if you and she's smart enough to know that she'll tell you when you need to go see a doctor.
Mhm.
She's done that to me several times. Let's see, how were COVID vax get administered? What was the approach towards it? We had once the vaccines got here, we had no problems getting them.
We had
Uh,
priority.
yeah, we got them, and we stood in line with the Thai people, and we can still get them, and they didn't cost us anything.
See, when they first came out, the government was pretty much forcing the Thais to take the Chinese version, the Sinovac one.
Yeah,
But once
Sinovac.
they
Yeah,
got the Pfizer and the AstraZeneca ones or whatever it was over here in Thailand, the expats community actually got priority over the Thais.
yeah,
Because I remember going to McCormick and getting my shots there. That's where the central location was at the time, and it was just all expats,
yeah,
you know. But they were, I know, like my mother-in-law, she was forced to get Sinovac, had to get like 4 or 5 of those shots. You know,
yeah.
I guess they were pushing them heavy because the government had bought in so many of the Sinovac shots. They wanted to get into the ties and not the foreigners, because the foreigners didn't want them, I guess.
Well, what I found and what I did, they had a registration process here,
Mm-hmm.
um, and I just happened to catch it on Facebook, and I told Leck, I said, we're going to go. It's up at Big C, and we went up to Big C, and I showed them my passport, and they set me up, and Leck and I were, we were in the first rounds to get the first shots once they got here. We had to go up to Bangkok Hospital. Oh, I went to Bangkok Hospital. She got hers down here at Hang Dong, and I had no problem at all. I got AstraZeneca the first time, AstraZeneca the second time, and then the third shot that I got here in the municipality. The municipality had set up a little area not far from here where you come in at 6 o'clock in the morning, and they had a big line you go through, and they gave me Pfizer. And
Mm-hmm.
I'm still debating on the fourth one. I don't think I'm going to get a fourth one.
No, I'm not either.
Yeah, they're recommending it, but I don't think I'm gonna go that route. I love the way Thais behave, concern for other people's welfare, and doing the right thing. Yeah. Well, I'll tell you what really helped us a lot was, and I don't plug politicians very often, but there was a lot of pressure put on the U.S. government, that to to get these vaccines over here. And Tammy Duckworth, who is the senator from Illinois, is half Thai. She's half American, half Thai, and she was the one that pushed that through. So we got the first 2 million doses. Um, it was really, we I don't know how many emails I sent off to the consulate here, and we were getting a form letter back, saying that
Mm-hmm.
you're on your own, you're on your own.
Mm-hmm.
And the problem was that the Thai government hadn't really planned well, and they were kind of on the back of the burner to get the good vaccines here.
Mm-hmm.
So we were trying to put as much pressure on the consulate here, which was absolutely falling on dead ears. Um, they had all got their shots, but as far as we were concerned, that we were on our own.
Hmm.
But fortunately, when she sent those 2 million doses over here, we were put, we were putting they were allocated. So many of them had to go to foreigners, and
Yeah,
that's why we were able to get the decent shots in the second
yeah,
time.
yeah.
And now, we can get them just about anywhere, and we don't have to pay for them. I
Mhm.
think where they give them now is the Mother and Children's Hospital up inside the city.
And I
You can
think
go there.
still at the mall too, they give them.
I
They got
don't
a
know.
vaccine clinic.
They may have. I know they had it there for quite a long time.
Hmm.
But I've seen posts that you can go to the Mother and Children's Hospital, and then uh, the Corn Ping Hospital.
Uh,
That may be the one right there across from Gecko. I'm really not sure, but yeah, they're available if we want them, and it's just a matter of choice. And we were not put behind the Thai people by any means. We were treated well, and even with if you came down with COVID, the Thai government was very, very gracious in treating the foreigners here.
yeah.
As long as you went into the government hospital, uh, take care, buddy. You be safe over there. If you went to a private hospital, you had to pay for it. But if you went to the government hospital, you would get treated, and it's just the way it is.
And I
But
think now it's just you're just on a house, I guess house
yeah,
arrest or
yeah.
whatever. You just stay at home now. You don't even go to the hospital.
I think a lot of people are just if they have it, they're just trying to stay away from people more than anything
Yeah,
else.
yeah.
One of the things that I want to say, and I meant to say it. I did a video today that will go out at 6 o'clock in the morning. So if y'all are waiting for the next video coming, it'll be probably 6 o'clock in the evening over there. But I'm going to launch it in the morning. I haven't finished it yet. But I was going to say it in the video because I see a lot of comments from foreigners on Facebook uh, complaining that people are still wearing masks here,
Mm.
and they are. I mean, the Thai people are wearing masks. I just left the market, and everybody's wearing a mask. Everybody's wearing a mask. If you go into 7-Eleven, everybody's wearing a mask. But you have to understand that before COVID, just about everybody wore a mask anyway, and they're just it's kind of sticking. You know, I have always said that the fact that COVID struck during smoke season, and we had all those, we were getting. Well, your wife can tell you how many flights we were getting direct from Wuhan during this time. We were getting people direct from Wuhan to Chiang Mai,
Hmm.
and the infection rate in Chiang Mai was not that high at first.
Hmm.
And I think the fact that everybody was wearing masks because of the smoke might have helped. And
Yeah,
I don't.
it was low for a long time.
Yeah, we went almost a year with no cases.
Yeah,
We went with no cases until I forgot when it started. I think in Bangkok, didn't it? And then just kind of
yeah, yeah,
whoosh. Within three
yeah.
months' time, we had they were hitting millions of
If I remember
cases. And
correctly, there was a holiday or something, and they allowed all those people from Bangkok to come up
yep,
here.
yeah. Songkran, I believe
Was
is
it
what it
Songkran?
was.
Yeah, and it
Yeah,
just
yeah.
spread like wildfire
Oh man, it was pitiful.
because they had all those people going to the clubs and stuff and
Yeah.
infecting everybody was during Songkrans.
Well, up here, it seems, and I won't name the club because I'm not going to name and shame, but there was a club here that um, it kind of started at because
Mm.
they had a party and they didn't have any social distancing or anything like
Mm.
that, and that's where it started. Pretty much, where it started,
Yeah,
and
I know
from
the
there it just
place.
boom, boom, boom. It's just crazy.
Yeah, they got caught a
But
couple times, I think, for that.
yeah, I think they did. Yeah, yeah,
Mhm.
and but now it's life here now is normal, and
Mhm.
I carry when I'm out walking around or something. I've got a mask in my pocket. I don't
Mhm.
wear it, but I do because if I walk into a 7-Eleven, I feel kind of obligated because the people behind the counter are wearing it. Uh, the Thai people are wearing them, and I mean, just to be polite, I'm going to put my mask on. I
Yeah,
mean, it's just the way it is.
yeah.
There's no regulations that say you have to wear a mask now. You know, if you don't, nobody's going to bitch at you, nobody's going to yell at you, but just, you know, as a kind of common courtesy to the people that are wearing them, I'll put my mask on. It doesn't bother me. You know, a lot of times it's down around below my nose. It doesn't do worth a shit, but you know,
I do the
you
same
never,
thing. You know,
you
you
know,
go to the
it's,
mall or whatever, just do
yeah,
like they do. Put it
yeah,
on.
yeah. I think on the airplanes now, they're still requiring it on the airlines and
Mm-hmm.
on the buses and trains and stuff like that. But as far as out, you know, out in the city, we went to that big concert, and there were, you know, like I've said before, there were more people there than I've ever seen in one place at one time. Nobody was wearing a mask. I mean,
Mm-hmm.
nobody. They were. But now, before we could get our tickets, when we had to go up to Niman to get the tickets, we had to show that we were vaccinated. They looked at
Mm-hmm.
my phone and made sure they were vaccinated, and then they gave us a sticker. Now, if we weren't vaccinated, I think they probably would have sold us one anyway. But you know, that's the way it was. And we went to another concert too, um, in one of the clubs up in the city, and this was probably back. Oh, it was probably about 4 or 5 months ago. Matter of fact, Charlie went with us. He came. He was up that weekend. He went, and we had to show our vaccination, and then they did the swab test before we could get in.
Really?
Yeah, yeah. And
Mm-hmm.
but that they're not doing that anymore. But
Mm-hmm.
you know, it is what it is. Hopefully, it's behind us all. And you know, I've talked to people that have had it, and it's well, you've had it twice, haven't you?
I know I had it once, but it was in the States and I was in the
Yeah,
hospital.
yeah.
So, yeah.
I mean, it's you don't want to get it. I had a friend of mine that I worked with back in the States, and his wife had had a stroke, and they put her in the hospital, and she was recovering. And while she was in the hospital, she caught COVID and she
Right.
died. Yeah,
Really.
it just took her out. So, you know, it affects different people differently, and you know,
Mm-hmm.
you roll the dice and see what happens. You know,
Yep.
I'm fortunate I haven't got it. I'm fortunate that Leck hasn't got it because she's got asthma. If she gets it, you know,
Mm.
she's going to have a rough way to go. But you know, hopefully it's behind us, and I hope that anything that comes from now forward is a whole lot less than what we've already been through. I
Yeah.
understand in China they're still having a heck of a time over there.
Well, there's zero COVID policy over there. I mean, one
And
person gets it, they lock down the whole damn district.
yeah,
You
well,
know?
you know, they were doing that here for a while, but they've stopped it.
Yeah.
They're not doing anything.
Yeah.
Well, anybody
No,
got
it's all good.
any more questions? I'll hold it open for a little while. Then I think I'm going to go watch my wife watch soccer tonight, or
Mm-hmm.
listen to her watching it. But I appreciate everybody that came in, and I appreciate the super chats. Really, we do. And if you look in 6 o'clock in the morning, my video from today will go up, and it's a pretty decent story. It's a little different than some of the ones I've told, but I won't tell you about it. You have to watch the video. And I'm trying to think of what else I did on that one. Some cool dogs in this one. I ran up on the cutest little dog today. That it was just adorable. It was sitting under a motorcycle, and it had a toy in its mouth. And as I walked by, he just kind of looked at me. You know, I looked down at him. I said, "What are you doing, buddy?" He's looking at me, and the lady she had it. She was in the store, and she was just kind of smiling. You know, I love dogs, but they were two really cute dogs. Well, it says, "What vax do I need before coming over? Who do you want to win?" I don't watch the soccer, so I don't know. I don't know who. Leck doesn't seem to have a favorite team. She just kind of roots for, I think, whatever color shirt they're wearing. If she likes the color of the shirt, she'll root for that team. Right now, you don't need any vaccinations to come here. They're not checking it. You can get in whether you're vaccinated or not. Um, Now, some of the hotels will check you, but
You know, a lot of times they say like, "Oh, you need yellow fever to come over here," but really, I mean,
yeah,
unless you're going out tromping in the jungle somewhere, you don't even need that.
no. Can I ask an off-topic section? We'll be going to Bangkok. Yeah, go ahead. I'll wait on you. Ask whatever you want to. We're here. Um, yeah, it's, it is what it is.
Yeah.
Let's see what we got here.
No, I think the only problem that someone would have would be, if you're flying like us, our connections through Japan. Well, Japan still requires you to show proof of COVID vaccination. So
Yeah.
if you're coming through Japan, obviously you're going to have to show proof of that when you get there. You'll probably have to show it in the USA before you leave, before they let you on the plane. And then you have to show it in Japan again. And they won't probably even look at it here.
Yeah. Dan, if you'll send me an email and tell me what you're looking for, I can probably help you out there. It's unseen Thailand Chiang Mai at gmail.com. Yeah, just tell me what you're looking for, and I can give you a basic idea of where to stay, or whatever you're looking for. There are a lot of good hotels up here.
Nice.
Well, listen,
hotels.
we're gonna close it off. Spencer, I appreciate you coming in.
You bet.
And appreciate everybody stopping in. Like I said, in the morning at 6:00, there'll be a new video up, and we'll go from there. But y'all have a great weekend. I hope everybody's doing fine, and we'll see you on the next one. Bye-bye.
All righty.